Welcome back. If you're suffering with painful varicose veins, seek out treatment now before they get worse. Vascular surgeon Dr. Roger Banal, a vascular surgeon from the Vein Center, is here to tell us why it's better to get done right away rather than to wait. Dr. Banal, welcome back to More at Midday.
Thank you for having me.
So why should someone not wait if they do have the painful symptoms of varicose veins?
Well, if they're having symptoms and pain and discomfort, then you ought to go ahead and seek medical advice and go ahead and get them treated. There are some potential risk of leaving things alone, and the longer that you wait, the worse that they tend to be, not only in terms of the symptoms, but also the size, and then subsequently the difficulty in trying to treat them.
Right. Now let's talk more about that. What are the benefits of the early intervention and seeking treatment early?
Well, some patients will show up and have simple spider veins. Some patients will have a combination of spider veins and large bulging varicose veins, and they'll have symptoms along with them. And so the workup and the process of treating them can get pretty complex. The longer you wait, the bigger those veins tend to get and the more prominent in other locations, so that it's a little bit more labor intensive. And there are some long-term potential risks of varicose veins in terms of skin changes and chronic scarring that do not necessarily go away just because you treated the veins themselves. So the earlier the better.
A lot of people may be thinking about varicose vein treatments and think of the old procedure of the vein stripping. It was very painful, but the treatments have really advanced a lot since then, right?
They've progressed for a number of years, and the old vein stripping procedures could be effective. It wasn't always the best procedure, but it involved being in the hospital, general anesthesia. It was a fair amount of recovery time afterwards. With the procedures that we have now, they're basically, not basically, they are completely office-based. We only use local anesthesia. There's no general anesthesia, and the patients walk in and walk out. And so it's progressed tremendously, and we've done, we're well over 5,000–6,000 of these procedures, and we're very happy with them.
Wow. Now, someone at home, if they're wondering if they have varicose veins, how does someone know?
Well, it's pretty, excuse me, can be pretty straightforward and obvious. Patients have big bulges in their legs. They'll have these scattered blue veins that are visible. They'll have discomforts, heaviness, tingling, burning, and aching pains. And so oftentimes you have a lot of leg symptoms that it's sometimes difficult to match with what you're seeing. But when you have varicose veins, it's pretty obvious and pretty visible, and the symptoms usually match what they're seeing.
Okay, really good information. Dr. Banal, thank you
Thank
so
you.
much.
Thank you.
And you've got a special offer for folks today. This is for the first 10 callers to 615-269-9007. We'll receive a complimentary consultation or a second opinion. Just call the number right there on your screen, 615-269-9007. The Vein Center has 2 locations, one in Belle Meade at 615-269-9007 and another in Cool Springs at 615-503-9895. You can also find more information on their website. There's a link on the More at Midday section of WSMV.com.